Sure, yeah. Fedratinib was the second JAK inhibitor approved for patients with higher risk myelofibrosis. And like most kind of second or third or fourth things that are approved for a similar indication, I think oftentimes those drugs can kind of get left behind or get underutilized. We know from both kind of upfront trials in newly diagnosed patients as well as in the relapse refractory setting for patients treated with Jakafi before or ruxolitinib that fedratinib maintains good efficacy with spleen size reduction as well as symptom burden reduction. There's been some newer studies looking at the real world use of fedratinib, kind of more long-term data. And it's all really shown that fedratinib is a safe and effective drug for patients with symptomatic or high-risk myelofibrosis. Um, I think as we get better at mitigating some of the side effects we see with fedratinib as well, like the GI toxicity, making sure people's thiamine levels are repleted, it really should be a drug that people would reach for, both in the first and second line setting when patients need a drug that has strong spleen size improvements as well as symptom improvements.